Hello, today is question and answer time. So I'll be answering your questions which you have asked me on polycystic ovarian disease. So the question I got asked the most was on what is the difference between a weight loss diet and a polycystic ovarian diet. They are actually very different. A weight loss diet is actually a simple creating a calorie deficit. The amount of calories you eat has to be less than the amount of calories you burn. If you do it consistently enough, if you do it long enough, and if your calorie deficit is wide enough, you will lose weight. You have to lose weight. But in a PCOD diet, I'm not really interested in your calorie deficit. I need to drop your insulin levels. And I can drop your insulin levels by decreasing or stopping all simple carbohydrates. The amount of calories you have in protein and the amount of calories you have in carbohydrate is identical. But protein doesn't give you the same insulin response as that of carbohydrate. And in carbohydrates, your simple carbohydrates have a much larger insulin response as compared to the complex carbohydrates. So in a PCOD diet, we'll be looking at stopping all simple carbohydrates consistently for a long term, bringing your insulin levels down for a long time, and eventually you'll get the results you require. Now, if you are a obese PCOD, obviously you will lose weight. But if you're a lean PCOD, you may actually put on weight. Another question which I get asked a lot is about exercise in polycystic ovarian disease. What type of exercise works the best? Now, exercise really is very, very helpful. And the two types of exercise which really help sensitize our cells to insulin and help you recover from PCOD earlier are 1. Resistance training, and 2. HIIT or high intensity interval training. So resistance training, you can use weights, you can use suspension bands, or you could use resistant bands. Now HIIT basically means exercising at very high intensity for a short time and then taking a shorter break and then repeating this over cycles. So the combination of good amount of HIIT and resistance training seems to be the most effective way of helping your diet do its job. There was a question on what are the long-term effects of polycystic ovarian disease. Metabolic syndrome or metabolic disease is an umbrella term, and PCOD or PCOS is just a small part of that. Therefore, if you were to control your PCOD with a diet and exercise, you would also be decreasing your chances of developing these diseases like cardiovascular diseases or diabetes or hypertension, and hopefully decrease your chance of developing some types of cancers in the future. And so many patients ask me, how long should I be on this diet? So would you need to be on a zero simple carbohydrate diet for the rest of your life? Well, actually no. Once you have reversed your PCOD and you have recovered from the active phase of PCOD, you can actually start looking at increasing your simple carbohydrates gradually, testing the waters, taking some simple carbohydrate, adding it a little bit and seeing how your body responds. And then you could probably do about 80 to 90% diet for about 6 to 7 months in a year, and maybe the remaining months you'll have to do 100% diet to bring back your insulin levels down. Or you could do a 2 month on, 1 month off, something like that, whichever works for you. But this will have to be with you for the rest of your life. So there was a question on polycystic ovarian disease and pregnancy. It's important that you do your diet and exercise well before you get pregnant, and continue with your diet through the first 3 months of your pregnancy at least. Anyway, in the first 3 months of your pregnancy, your baby has got no use of any calories from you. So your requirement of food is primarily in the last 2.5 months of pregnancy. So doing a polycystic ovarian diet for the first 3 to 4 months actually has been shown to be beneficial for your pregnancy. Now we know that in the first 3 months of pregnancy, most girls would have some element of nausea or vomiting. Now this just helps you if you have PCOD to continue your diet. So a common question I have is, how do you maintain motivation? You achieve your goals of getting pregnant, you achieve your goals of getting irregular periods. How do you continue the motivation of continuing with the diet? Well, that's a tough one. Especially with when you open up your media, your social media or your TV, you'll find so many cookery shows and tutorials on making very tasty foods, and nearly 99% are all carbohydrate based. So it's yes, it is difficult. So I would suggest make a self-help group of girls who have polycystic ovarian disease and motivate each other. Share recipes to make your meals tastier. Motivate each other when you feel that the motivation level in one of your group friends is decreasing. So that would really help. I had received a question on seed cycling. Now, seed cycling is a concept wherein which you take different types of seeds at different types of a cycle, and it's said to help your hormone levels and in some cases polycystic ovarian disease. There are no trials, there are no research to suggest it really works. There are anecdotal results to suggest it may work, but there's nothing concrete to suggest that it really will work. I also had a question on green tea. Now, you could have green tea. I personally don't think that's an issue, but you would not be able to add any sugar or honey to it. So another question I had was on health supplements. So like I discussed in one of my capsules, I would normally give some vitamin E or omega-3 fatty acid supplements, folic acid if you plan to get pregnant, but nothing much more than that. You also get all sorts of protein powders and supplements available, but I normally do not recommend so. So I got a question on do's and don'ts of diet. Well, what you should not do is do it for about 20 days and stop it, or do it for about a month and then take one cheat day, because this cheat days doesn't work for a PCOD diet. Cheat days work very well for a weight loss diet, but not for a PCOD diet. So you would need to continue your diet till you get reversal of your PCOD. Until you actually do that, you really should not be taking a cheat meal. We call a PCOD diet an unforgiving diet. Just one mistake and you go back to square one. And that's sad. And that's difficult. But that's how it is. A common problem we have is a girl comes along with PCOD. She diets wonderfully well, gets her results of getting pregnant, delivers her baby successfully, and then she just eats everything. About a couple of years later, she'll want to get pregnant again, and she finds it very difficult to do the diet, to get motivated to do the diet, and ultimately she just gives up and just sticks with one child. I normally recommend my patients to, if you've got a plan to have 2 kids or 3 kids, keep your diet running even after delivery of the first one, get over with your second one, continue your diet, get over with your third one. And once you're completely done with your family, maybe you could look at maybe increasing your carbohydrate levels in your diet. But as long as you've got PCOD under control and you've not reached your goal of your family size, don't give up. Don't give up. Okay, so these are the few of the questions which I received on polycystic ovarian disease over the last couple of weeks. I must thank all of you for your responses, for your comments, for your questions, for the encouragement which you have all given me. So if you have some more questions on polycystic ovarian disease, or you would require some clarifications, please do put it down in the comment sections. And if I have a sufficient number of questions, I will definitely do one more capsule on those questions asked. So as usual, please do click like, please comment, and don't forget to subscribe and click that notification bell so that when the next capsule comes up, you will be notified. So thank you very much.